Good afternoon, everybody. This is our first conference, so just kind of bear with us. But I'm Mikhail, and this is Terica. I'm a family nurse practitioner. I've been working in the underserved community for almost 3 years now. Also, I own my own virtual weight loss clinic, so if anyone is interested, let me know. Okay. As well as we have our podcast called Shades of Health Podcast, and it's all about just bringing awareness and information to the Black community. Terica, you can introduce yourself a little.
My name is Terica. I've been a registered nurse for going on 9 years. I worked at multiple hospitals in Memphis. And I recently received my master's degree, and so I'm moving to the healthcare administration side of nursing. Yeah.
All right, so we'll get started. So today we're here to talk about health literacy. Health literacy is important because it's basically you having the knowledge and the tools that it takes to be able to take care of yourself. So Trelise gave me the scripture that she gave us was from John, with 3 John 1 and 2. Beloved, I wish above all things that thou mayest prosper and be in health, and even as thy soul prospers. So God wants us to be in good health. That's a part of his will for us. And he also said that we perish because we lack knowledge. So today we're going to tie that into breast cancer awareness. Black women are more likely to be diagnosed at later stages of breast cancer. We're about 40% more likely to die from it. Although we typically don't have breast cancer, when we are diagnosed with it, it tends to be deadly. Mainly because we lack the health literacy, which means that we don't know the signs and symptoms. We don't know when it's an emergency. We don't know when to go, get our health screenings. So health literacy, I guess you go to the next slide. Health literacy basically means the ability to find, to understand, to use health info and services to make informed decisions about our health and well-being. So when you have health literacy, you're able to prevent health problems and protect your health. You can help manage your health and chronic conditions better. You can lower your healthcare costs, and you're able to understand treatments and able to avoid hospitalizations. So these are some of the barriers that we have in the Black community: mistrust, lack of access to cultural competent care, communication gaps with healthcare providers, and fear. So I'm kind of going to talk about it a little bit. Just last week, I had a patient who has asthma. She's a Black woman. Remember, I work in an underserved community, meaning that they're poor, they don't have insurance, and they're in poverty. So she came in, she's 70-something years old. She couldn't breathe. She waited for 3 days to come in for treatment. And when she got there, I wasn't trying to be judgmental or anything, but I was like, how come you didn't go to the emergency room? And her thing was, well, I thought y'all could do something for me. So it's important to know the difference between going to the emergency room and when to come to the clinic. However, while she was there, we gave her treatment. And so I was like, looking at her profile, she couldn't breathe. Her saturations, which means that the oxygen level in her body was low, like it was in the 80s. You need to be in the 100s. She had respirations that was like in the 30s, and her lung sounds, they sounded terrible, y'all. Like you couldn't even hear anything. It was just wheezes. And so I was like, y'all call the EMS. And so me being the provider that I am, I always like to get a second opinion just to make sure I'm doing the right thing. So I got my doc over there, and he was like, well, we'll just give her albuterol treatment and give her a steroid, and that should prevent her from going to the hospital. So I was saying to myself, no matter what he says, I'm going to send her on to the hospital. And so that day when she went, something told me just to call and check on her, like this week. I called her. She was still in the hospital. She had been there 4 days. And she told me, she said, Provider Sharkey, if you had not forced me to go to the emergency room, my hospitalist said I would have died that day. And she said, I thank God that you forced me to go, but she said, because I live at home and no one would have even known I had died. So I say that to say, as Black people, as Black women, we have to advocate for ourselves, because you might not have a provider who's going to advocate for you who looks like you. because a lot of times when we work in these communities, we see it all the time. They get a little jaded. Oh, I've seen this before, they all right. You just patch them up, send them home. And her reasoning was because she didn't want to take home the bill. But I always say better safe than sorry. You'd rather go ahead and get that bill and you're okay than you wait and you end up there for weeks and days. So we can move forward. So,
Well, you kind of touched on
well,
this,
yeah.
but-
Berries in the Black community, I was going to give y'all a little bit of statistics here. Almost 24% of African Americans in the United States have below basic health literacy compared to 9% white. And what that means is just a simple ability to read, write, understand simple instructions, follow directions, and to count. And y'all don't understand how many people that I come across that can't even read. And these are grown people. They don't even have a third grade reading skill. So like, if you can't read on a third grade level, you ain't gonna understand what I'm telling you. Like, oh, take your medicines 12 hours apart. That just means twice a day. So like, we're in a situation here. Lower health literacy in Blacks is linked to poor management of chronic diseases like hypertension, diabetes, and asthma. We are less likely to engage in preventative care, which is cancer screenings. Has anybody got their flu vaccine? Well, good. Checkups. So it's important that we get our yearly checkups as women. Good. She got her mammogram. It's important as women we get our well woman exam where they examine your breast, you get your pap smear, and that's like every 3 to 5 years. So pap smear, that's kind of off subject, but we're checking for HPV and cervical cancer. All right. So we can move forward.
Okay.
So what is breast cancer? Breast cancer is the most common cancer among African American women, with an estimated 33,840 new cases in 2024. African American women are 40% more likely to die from the disease due to later stage diagnoses and limited access to care. That's because we're not searching, we're not learning what to look for and when to come get help. And even if you're not 40 or 50, you still need to be checking your breast. You should do it every month in the shower or however you want to do it. So breast cancer is uncontrolled growth of breast cells forming a malignant tumor. Malignant just means cancerous. It's invasive. You have two types. You have invasive, non-invasive. Invasive, it spreads beyond the breast tissue, and then non-invasive remains in the breast ducts, which means it just sits there. Then you have a few types of breast cancers, but the most common are the ductal carcinoma. Ductal carcinoma is the most common type of breast cancer. It begins in the cells of the milk duct, which are the tubes that carry milk from the lobules, which just means where the milk is made, of the breast to the nipple. So where it's made and your nipple is where it comes out, right? So you have two types. You have in situ, some health literacy here. In situ just means to sit, in sitting. This is a non-invasive form of cancer, meaning the cancer cells are contained within the milk duct and haven't spread. If it's caught early, it's highly treatable. Fun fact, my mom had it when I was a senior in in college. I was getting ready to graduate. My last year of college, and they caught it at an early stage. They were able to treat it. She decided to go ahead on and have the mastectomy, which means the removal of the breast. So she didn't have to deal with it anymore. So she's been cancer-free in that aspect for a very long time. We thank God for that. And then the next one is invasive ductal carcinoma, which is more serious because, of course, invasive means that it's moving. It is in areas that it should not be. It's invading. So it's beyond the breast duct, the breast tissue, and it can potentially spread to other parts of the body. Then you have lobular carcinoma. Remember, that means where the breast milk is made. The glands in the breast responsible for producing milk. There are two main forms. We got in situ and invasive, which means one is moving and one is sitting. Then we have triple negative. Triple negative it accounts for about 22% of breast cancers in Black women. So remember when I said we're less likely to have breast cancer, but when we do, we typically die from it because this is the type that we normally have, triple negative. It disproportionately affects Black women who are diagnosed with it at nearly twice the rate as white women. Black women are more likely to develop this type of breast cancer at a younger age and are at a more advanced stage. Because triple negative is more aggressive, it is harder to treat. This contributes to the higher breast cancer mortality rates in Black women. So we can keep moving. I think the next one was, am I at risk?
Yes.
Okay, then we'll go back to that. Okay. Am I at risk? Are you 40 or older? Dense breast. Most Black women are considered to have dense breast tissue. Did we start our cycles at an early age, like before 12? Have we had a previous cancer diagnosis? Are we in hormone therapy? Hormone therapy can also mean, am I taking birth control? Are we treating things for menopause? Late age of menopause. Relatives with cancer, like a first degree relative, which would be a mother, a sister, or a daughter. And then we have genetic mutations, which we cannot really do anything about. Most of these things we can't do anything about. But women between 40 and 44 have the option to start screening with a mammogram every year. Women 45 to 54 should get mammograms every year. Women 55 and older can switch to mammograms every other year, or they can choose to continue yearly mammograms. Screening should continue as long as a woman is in good health and they have at least 10 more years of life. So at a certain point, you'll stop getting a lot of different screenings, but it is your choice to keep going. A woman with a first degree relative who was diagnosed with breast cancer before age 50 may consider starting mammograms 5 to 8 years early. Our rule of thumb is 10 years. So if my mom had cancer at 49, that means at 39 I will start. But I've already had my issues, so I've already started getting my mammograms. So another thing I want to say, when you're checking your breast, if there's anything abnormal, a lump, if your breast is having discharge, if it's red, if it's flaking, if it's swollen, you need to go get help. You need to go to your doctor, and that will constitute you getting a mammogram. Your insurance will pay for these things. All right. And what should I look for? Some things I already said. Armpit.
Okay, sorry.
You good? Armpit pain. That's another one that's kind of vague. But if you're having pain in your armpit, you're feeling a lymph node, which is what I did. I went and they made me go get a mammogram. Fun fact, the issues that I was having over here wasn't even what they saw on the other side. So they saw something that wasn't even bothering me on this side. But luckily, thankfully, God is good. Everything was fine. I had to go get a biopsy. It was scary, but the Lord, He provided. He made sure I was okay. So these are different symptoms. You got dimpling of the breast, skin texture changes, pulled in nipple, which just means that it's inverted, which means that it is inside out. So it went in. And that's something that's not new. Well, something that you have not had before, because some people, they do have inverted nipples already. Lumping or thickening, armpit pain, skin irritation, and then a visible lump. All right. And then this is the one I'm a stickler for, lifestyle and environmental risk factors. So these are some of the things that can cause breast cancer. So giving up smoking, I don't think a lot of us smoke. So that's a good thing. Reducing alcohol consumption. So I'm just kind of gonna go into detail. Obesity and overweight. I'm a stickler for that because I own a weight loss clinic and then I see it every day. So approximately 57.2% of non-Hispanic Black women, this is coming from the Center of Disease Control, CDC, are classified as obese. That is a BMI greater than 30. The obesity rates among Black women have been steadily rising over the past few decades. In 1990, about 39% of Black women were obese. By 2020, that was just 4 years ago, this rate has increased to over 57%. Black women have the highest rates of obesity among all racial and ethnic groups in the United States. Obesity increases the risk of developing postmenopausal breast cancer. Postmenopausal means you don't have a cycle anymore. So usually that's closer to 60. Sometimes it hits a little early, but that just means you've not had a cycle in over a year. So the risk of developing postmenopausal breast cancer by 20 to 40% compared to women of a healthy weight. So that's a lot. Obesity is linked to at least 13 types of cancer, with breast cancer being the most common cancer associated with a high BMI. 1 in 5 cancer-related deaths in women are attributable to obesity, which is a significant proportion of breast cancer deaths. Well, basically, it falls in that category. Obesity, breast cancer is a high category. And also, if you are diagnosed with cancer and you beat it and you're still overweight or obese, you have a higher recurrence of it coming back. So Black women are more likely to be overweight or obese compared to white women, partially due to the socioeconomic factors, diet, and access to healthy foods. So well-known risk factors for breast cancer, particularly after menopause. So the reason why is because excess fat tissue increases estrogen levels, which promote the growth of hormone-sensitive breast cancer, which is that triple negative. So that makes it harder to treat. So weight loss, and I'm not trying to scare y'all, but it's real. Yeah, I'm not. Look, me and Terry talk about it all the time. Like, we're not in the business to try to hurt or really make money. We're here to help. Yes, ma'am. So weight loss and maintaining a healthy BMI can lower the risk of breast cancer, particularly after menopause. So that means we have up until we hit menopause to try to get together, y'all, to get the lifestyle together. Because typically after that it's harder. Even a 5 to 10% reduction in body weight can significantly reduce breast cancer risk. And I'm about to go into the physical activity part of it.
Okay, that's fine.
Okay, so according to the Journal of the American Medical Association, they found that Black women who met the recommended level of physical activity had a 30% lower risk of breast cancer compared to those who did not engage in regular activity. The American Cancer Society recommends that adults engage in at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity exercise per week. And all that means is just 30 minutes a day. If we can break that down to 10, 10, 10, or 5 and whatever, just get that 30 minutes in, no matter how you do it. And walking is the best way to get that. It don't matter what you do as long as you hitting that time. So a sedentary lifestyle increases the risk of breast cancer. Regular physical activity helps control weight, reduce inflammation, and regulate hormones, which can reduce the risk. Studies show that Black women are less likely to meet recommended levels of physical activity because more than likely where we live, the lack of access to parks and gyms, and time constraints due to work or caregiver responsibilities. So basically, Black women are way more stressed out. That stress or those cortisol levels lead to being overweight. Their overweight creates that extra estrogen, which allows that cancer to grow. So we got poor diet. Oh, my bad. No, you good, Terica. Poor diet, processed foods, red meat, saturated fats. We're not eating enough fruits, enough vegetables, enough whole grains to help with the inflammation that we're getting. Many Black women live in areas that are limited to access to food. I don't think that's one of our issues, but where I work, it's a food desert. All they have is fast foods. And when you go into their grocery stores, it's a ways to get there, and then it doesn't look like the grocery store in Cordova or in Germantown. It looks completely different. So alcohol consumption, even a moderate drinking situation, can increase your risk because it promotes the estrogen. And we talked about the environmental toxins, like certain things you put on your body, skin lotions, beauty products, they can do that. Reproductive health, if you start your cycle later in life, have kids beyond 30, some of these things you can't help, and I always say God keeps us. So what we can't control, he can control. So I'm here to say, hey, we can control our weight, we can control working out, eating right, we can control those things. So let's work on what we can control. And I'm going to be sticking on chronic stress is a big thing too. Black women often face higher levels of stress due to factors like systemic racism, financial struggles, and caregiving responsibilities, which exacerbate health issues, including breast cancer. And I tell you, stress is another leading cause of cancer. We are very stressed out. I read an article that said that Black women are America's work mules. So they depend on us to keep things going. When the average person or our counterparts, they'll quit and cry and be like, I'm not doing it, but we'll stick it out because those jobs become our identity. And so it's killing us. But that's the end of my portion. I'm gonna let Terica take it on home.
So Mikhail kind of touched on this as far as when should we get screened. So obviously, if you have those relatives those first degree relatives who had breast cancer, you're going to want to start 10 years earlier than they were diagnosed. However, for the average person who does not have anyone in their family be diagnosed, then ages 40 to 44 is when you should first get your first mammogram. Between 45 and 54, you should have one every year unless your doctor recommends otherwise. And then 55 and older, you can switch to every other year, or you can continue your yearly mammograms. So as long as you're in good health, you're expected to live at least another 10 years, and you can follow this recommended schedule. And this is recommended by the American Cancer Society. So this is really important because a lot of times we miss the signs, and by the time we have that yearly exam, or even if your OBGYN is just checking, you probably could have caught it at home. So once a month, you want to self-examine at home. You either want to stand in front of the mirror, or if you're in the shower, but you want to examine your armpit. You want to, use the ball points of your fingers. And you're just feeling for those signs and symptoms. So those lumps, you want to go up and down. You want to go around the breast. You want to squeeze the nipple and see if anything feels different. You can also do it in the bed as well when you're laying flat on your back. But you should be doing this once a month, okay? And so a lot of times by the time you get to the doctor, your OB, and they find something, you probably already, could have caught it at home. So we always know that early detection is good, and we're going to touch on that. So early detection is key. Early stage breast cancer, stage 1, has a 99% 5-year survival rate, whereas late stage cancer, stage 4, has a much lower survival rate. So the earlier that we can catch these signs and symptoms, the better off we are, and the more likely that we will survive breast cancer. So going back to ways to improve health literacy, this is something that me and Mikhail are really passionate about, especially working with African Americans on a daily in the hospital. I'm always encouraging my patients to ask questions. A lot of times you will have providers that don't look like us, and they don't speak our lingo. And they'll come in and they're saying all these big words and you don't really understand. So always ask questions during your appointment. Seek clarity when they diagnose you with something or they offer a treatment. 9 times out of 10, there's more than one option. And so a lot of times they do present you the one option that they want to do, but that may not be the only option that you have. Ask for a second opinion if desired. I truly advocate, if you're able to get a Black OBGYN, to get one, or a Black provider. Women's Physician Group is great. They're, I don't know, some of you all may use them, but they are, I use, Dr. Anderson. Yes. But their entire physician group is African American. I don't want to just, if you have a great one, that's good, but it really is important when we're talking about our health that we see someone who looks like us and who understands our plight. So ask your provider to use plain language. Like I said, there's a lot of terms that we may not hear on a day-to-day basis, and you really want to understand what they are talking about. Bring someone with you. You'll be surprised how many patients are in the hospital for days and weeks and they never have a visitor. They never have someone come to see them. And I have sat in on cancer diagnosis, and I was the only one there, with that patient. So if you have someone, cherish that, bring them with you. Always use trusted resources. You kind of touched on podcasts, and me and Mikhail touched on that in our podcast as well. Instagram and TikTok are so big right now. You're seeing everyone's giving their opinion about something, but they don't necessarily have the credentials to back that information up. So you want to use trusted resources. The CDC, Medline Plus, Black Health Advocates, Mayo Clinic are really good sources. And then ask for handouts and visual aids. So for a lot of times for diagnosis, there's something printed that they can give you that you can read, take home, share with somebody, let somebody else read it over. So those are all ways that we can improve our health literacy.
I was going to add to that real quick, Terica. I know some clinics have like the Helo app or things you can go on to look at your chart. Like go in there and look at your chart and see what we're testing you for, like what your blood pressure was looking like, what your sugar was looking like, because those are ways you can improve, and then you'll know what's going on during your visit. And like she said, like have somebody there. Also write questions down. Like don't leave until you understand what they're talking to you about. Like tell them to break it down to a 5th grade level. Like, sir, I don't understand. Like talk to me in layman's terms. And we can switch it over. Like, yeah, your stomach, this is what's going on with you. Like don't leave until you understand.
Yeah, super. And these are a few national resources. You have local organizations like the Sister Network, Inc. It's the largest and only national African American breast cancer survivorship organization. They offer support and advocacy if you're diagnosed with breast cancer. And then you have national resources like the American Cancer Society. And then everyone sees Susan G. Komen all the time, the breast cancer walk and everything. But they provide education, financial assistance. You can find breast cancer statistics and education on there as well. And feel free to take a picture of this slide. So these are some local resources within the Memphis area that we have for testing. So you have the Margaret West Comprehensive Breast Center. They are able to do mammograms, breast MRIs. There's also a second screening location at St. Francis Park. You can schedule an appointment if you need one by calling that number. Sisters Network, Inc. does have a Memphis chapter, and they focus on breast cancer awareness, particularly within the African American community. They're located at St. Paul Baptist Church on East Holmes Road, and their phone number and email is there if you need them. Some of you all may see this Baptist Women's Health Center truck. I don't know if you all have seen it around, but they will set up at different like conferences and festivals, but they offer a mobile mammogram. And so you actually get your mammogram inside of this truck. And so they are able to bring that screening services to various locations across the city. Yep. Oh, you had one? Okay. But yeah, I've heard great things about it. Great privacy and good care.
I think Methodist has one too. And I was going to add to that, if you find yourself in a situation where you don't have insurance, they have programs. I know the one that we use the most is Tennessee Breast. You can go on TennesseeBreast.com and then they'll, I guess, show you whichever clinic that is available that accepts that, and they can get you set up for a mammogram and pap smear. So for free, they'll take care of it. And if you are diagnosed with cancer, I've had patients who were diagnosed with cancer, they'll pay it throughout. They'll see you through the whole situation. So there are resources out there for us.
Do they only service Tennessee residents? Or
Tennessee Breast is only for Tennessee residents. Yes, ma'am.
All right, and so our call to action to you all after hearing all this information, we hope that you will schedule a mammogram or remind a loved one to do the same. Stay informed about breast health and share this knowledge with friends and family. And then prioritize your self-care. So making sure you're getting your regular health screenings, you're doing your monthly exams, watching your diet, getting your exercise in. But we definitely want to empower you all with this information.
Can you repeat the women's group? The name?
Let me go back for you. Was it, you talking about this slide?
No, you mentioned a women's group of African American.
Oh, the Sisters Network, Inc. And they're located at St. Paul Baptist Church on East Holmes Road. Yep.
No, I think there was another name that you gave.
Women's Physician Group. They're off of Poplar. What street is it? Poplar, White Station. Yes. Uh-huh. Yeah, but they're all of the providers there are African American. It's maybe 5 or 6. But all of them are African American. Yes, ma'am. Yes, ma'am. I love them. And do we have any questions or comments?
I have a question.
Thank y'all.
Thank you.
Yes, ma'am. Go ahead.
You mentioned about fear,
Mhm.
okay, of African American going to the doctors and getting services and stuff.
Mhm.
What would you suggest those of us that are having to deal with those type of individuals? What do you suggest us do? Or what would be our information that we give them to kind of, because I know fears come from,
Mhm.
but we still got to deal with it. So I wanted to find out, what can I say to somebody?
Don't let fear take you out.
Yes, ma'am.
Because God gives us revelation and He gives people here to help. You can wait to the last minute and it be too late, and God actually reveals something to you in the beginning to go get His seed about. There are so many people, and I think my mom has an example of this lady that worked with her. She felt something in her breast this summer. She waited until now. Somebody had to force her to go get it, seed about, and now she's dead. So, because of fear, we can't let fear control us. We have to do it afraid. So, and as Black people, we fear a lot of different things because we don't know, which is why it's important to research and go to those accredited websites to get actual factual information.
Mhm.
Stop listening to TikTok and Instagram and stuff like that.
Yeah.
Like, read a book, but yes, ma'am. They say I'm too blunt sometimes, but
Yeah.
Go ahead,
But
Ted.
I think presenting like statistics to them doesn't
Mhm.
work, because that further ignites that fear
Mhm.
within them. But being a support person is what I would suggest. So like I was talking about, Brent, I'll go with you. And so them having that support person there really, helps them, because if they do find something, then who do they lean on in
Right.
that moment?
Right.
So I would definitely advise to just offer support, but don't bog
Absolutely.
them with like 40% of women die.
Yeah.
So so then they're like, I'm not going, but just being that support person is what I would suggest. So.
And I always say, just pray that the Lord opens their mind up to listen, so they can get the help because if it's caught early, it can be treated most of the time.
I just had a situation that happened with my sister-in-law this past week or so. And she went to St. Francis
Mhm.
emergency.
Mhm.
They didn't do anything. They sent her home.
Mhm.
Okay. And I went over Sunday and I looked at her. I said, oh, something wrong. And so I really compelled her not to take what they had said because something was wrong.
Mhm.
So she went back the next day to the same emergency room. And they had a different doctor this time. And y'all was so right. Sometimes our counterpart look at us and say we sit in our heads or whatever. But they didn't, they still didn't do anything.
Yep.
Took her 3 visits. And finally, the third time she went to the hospital emergency room.
Mhm.
And they found bleeding in her small intestines. Right? But they had to do a upper and a lower. They had MRI, just a CAT scan, whatever they did. And they found it. But I just thank God that I pushed. So we have to sometimes do what you just said. We have to, and I had this look on my face because I've been there, done that. She know my story. I almost died in 2007, 2015. I'm not even supposed to be sitting here because if I had waited any longer, I would have been dead. He told me, you got to wait 30 minutes, you've been out here. But God saw fit now for that to happen to us. And so I'm an advocate now. I push now. I push it. I start acting like you can't breathe. Come on, let's go.
Right. Absolutely.
Yeah, and yeah. And I don't know if she went back to St. Francis, but even in those situations when one hospital system, and I know we sometimes get tired with insurance because our insurance is only covered, at certain hospitals, but we see patients all the time when I worked at Methodist or Regional One who came from outside hospitals and we found the problem, but the other hospital didn't, and so you see that sometimes too. You just never know who's on you
You
know.
don't have the same symptoms.
Mm-hmm.
You can't let that go.
Right,
I don't
right.
know what's wrong with you. You're looking real weird to me.
Mm-hmm.
And you say you've been to the emergency room. They didn't find anything. Well, you look like something.
Right,
there,
right.
You know?
Mm-hmm.
So I'm just saying. I know when you say that stuff, because you know how I was. I said, oh, I'm all right. I just got the flu. Man, I had 2 clots in my lung.
Mhm.
Right? Wow. And I wasn't gonna be here.
Mhm.
Yeah.
Mhm.
And if I hadn't gone when I went, a skin color was gray.
Mhm.
And nobody knew, what they looked like. But I thank God that I'm here today to tell this testimony because I want to make sure that we advocate for our people and
Yes,
fight
ma'am.
for them.
Yes,
They
ma'am.
are fearful.
Right.
And I don't know, it probably was a little fear too. It was.
With this lady,
With me.
with you. Oh yes,
Yeah.
ma'am.
Mhm.
Oh yeah.
With me.
Absolutely. Yeah, the lady I seen last week, they said the base of her lungs, which is the bottom, had collapsed. And so it was something we couldn't see. But the lady said if she would have went back home, should have been dead.
My Lord.
And so I know it scared her, but I was, like I tell her, they're not gonna advocate for you like we advocate. I look at you, I see my grandmama, I see my mama, I see my auntie, and I'm like, I worked in the ICU, I worked in the ER, and I know what it looks like. We wait to the last minute to get help, and we'll go and we'll trust them before we trust people that look like us. We're sitting here begging, like, please do this, please do that, and
They teach colder, they teach sweeter than I teach.
yeah, absolutely.
That's right.
That's the complex though. That's the complex. That is the complex. And they feel like their word is bond. I come here because I feel like you can do something when I'm looking at you like, ma'am, please go to the hospital because they're gonna patch you up and send you home. I might not be here. You might come on a day, I'm not here, and he done sent you on home.
That's why it's important to have somebody that with you.
Exactly.
It is, yeah.
Exactly.
Yonder, back yonder, she our fighter, That's a better criminal right there.
And I would say this, if you feel like the hospital didn't do anything, go to another one.
That's right.
You got like 6 hospitals in Memphis. Go to the one that's gonna do something for you.
Yeah. And forget the bill.
Forget the bill.
that comes months later sometimes, and you'll be surprised.
My mama had a stir in.
Yeah.
Tell her they gonna come take her furniture. She said, well, I didn't buy it no way.
Any more questions? Yes, ma'am.
Very well.
Thank you.
Thank you.
Do a visual example of examining your breast.
It don't matter. I got on the
So
coat.
I'm not really blessed in that area.
Me
So
neither.
my exam is a little easier. But if you have heavier breasts, you do want to lift. So I can't show that because I don't have it. But you do want to lift, and you're making sure. So if you're holding here, you're using the ball points. So you're just feeling around, and you want to go all the way around. And so get a baseline, because if you don't have lumps now, then you know that this is what your breasts feel like, right? So that way you'll know what's different. But you want to go up and down. And so the armpit has a lot of lymph nodes in it, and so we know that that's how cancer can spread. So you want to check your armpits as well. And I just usually hold my arm up. And so I'm going up and down, and I go all the way down to the base of my breast, and then I'm going all the way back up.
And I will also say, come up here too.
Yeah, up here.
Up in here. And then also squeeze your nipple because you want to make sure discharge isn't coming out.
And what you do about your husband or the man in your life? They have breast cancer.
Yeah, they do the same thing.
Yes, and we didn't touch on that, but men, and we don't have any statistics, but men can get breast cancer as well. They have breast tissue. And so it's not talked about as often, but they should be doing exams as well. And so it's a little bit easier for them too. And a lot of times they can see their lumps before they actually feel them. Whereas we have, usually denser breast tissue. But just a point to hit home, if you do have heavier breasts, you want to make sure that you are lifting and just feeling all the way underneath, all the way around. So I use a circular motion back and forth, and then an up and down across. Up and down from the top to the bottom, and then I make sure I get my armpit. Yeah.
And it's good, like if people who aren't menopausal, who still have a cycle, do it the week after your cycle.
Yes.
Because typically your breasts are tender. You will probably feel things that are hormonal. because at that age, that's normal. You have hormonal lumps and knots in it. But the unnormal thing is after that week, and they're still there. You see what I'm saying? So as women who are still having a cycle, we have hormones, which causes our breasts to be tender. You will feel different things that are not typically lumps, but they're just kind of hard spots. Yes, ma'am.
Okay, so I have a 14-year-old.
Okay.
And first of all, this is awesome information. A lot of these things I never really thought to even think about or to research. So thank you, especially for the women's physicians group. I'm definitely going to try to get in touch. I didn't even know that was a thing. So thank you for that. This is very much needed. But I have a 14-year-old, and I was just wondering at what time frame should I start introducing, because she just started her cycle, like telling her, hey, I want you to start checking. Do I wait till she get a little bit older, like 18 or?
No,
You can start now.
I say now. I think puberty is a good age because they're going through these hormonal changes.
Okay.
And so this is a good time. It links into that because you'll explain to her, like, do it the week after, your period. But I feel like it's never too, early. I think that puberty is a great age. Yeah. Too. And there's, you can look up, they have books and things that are geared towards kids that age, that has that language that they can like understand, and so they're not going to get a lot of these terms, but they'll understand like lumps and knots when you explain it that way. So, yeah.
Any other question? No?
Last. Thank you.
So this is our podcast, Shades of Health podcast. If you want to tune in, we typically drop on Wednesdays. So if you want to learn more about different things that affects our community, please scan the code, just join in, and I promise you'll probably get a lot of knowledge from it and enjoy it.
Yes.
We will, amen.
Thank you.